Okay.
Hi, good afternoon. How are you?
I'm doing okay.
My name's Jen. I'll be taking care of you today. So what brings you in?
Yeah, so I've had like a cough for a few days and just feeling so fatigued and a sore throat. My ears kind of bother me here and there.
Okay, both ears?
Yeah,
Is it pain or is it more pressure?
yeah, it's like a lot of pressure in my nasal cavity area.
Okay, and how long has this been going on for?
Probably like the last 3 days.
3 days. So it started 3 days ago. And has it been getting worse, do you feel like?
Yeah, it has.
Okay, so you got the pressure on the face, the pressure in the ears. How's your cough? Is it productive or is it dry?
It's like, yeah, it's pretty dry.
Okay. Is it keeping you up at night?
Some nights, but not so bad.
Okay, so do you have any allergies to any medications?
Yeah, penicillin.
Okay, what happens when you take penicillin?
It's just like a mild reaction. Like I just get a couple hives here and
A
there.
couple hives, but it's never affected you more than that. When's the last time you took that?
Oh man, probably when I was like, 5 years old. Or something.
Okay, and then haven't taken it since. Okay. And do you have any chronic medical conditions?
No, I don't have any. No,
Okay. Do you take any medications on a daily basis?
no, just like supplements.
Okay. What kind of supplements?
I take vitamin D. I take magnesium. I take omega-3.
Okay. Last menstrual period?
I think like 3 weeks ago.
Okay. Are you on any form of birth control or anything?
No, I'm not.
Okay. All right. So I'm going to check you out. We'll see what's going on and we'll get a plan together. How's that work?
Sounds good.
All right. I get some vital signs on you.
Okay.
You can go ahead and take that hand and lower your mask down for me. I'm going to get your temperature.
Okay.
Really good blood pressure. Don't have a fever, 98.2. The blood pressure is 114/72, and your vitals look great. On a scale of 0 to 10, can you tell me your pain level right now?
Yeah, it's mostly like right in here, and it's probably like a 5.
All right, is it constant or does it come and go?
Kind of comes and goes.
Okay. Is anything that you make it better or worse if you try taking Motrin or anything like that?
Sometimes doing like a nasal spray or like a what's it called, a Medipod helps a little.
Okay, helps relieve it.
Mhm.
Okay, so I'm gonna go ahead and check you out. Just do an exam real quick. Okay, here.
No.
All right, I'm gonna take a listen to your lungs. If you can sit forward for me real quick.
Yep.
Put your hair. All right, deep breath in. Good. One more time. One more time. Sit back for me. Go ahead, lift your heart. All right, if you can lower your mask. All right, I'm gonna start by checking in your ears.
Okay.
You said you've had some pressure.
Yeah.
Any discharge from your ears that you've noticed?
No.
This side. Great. No problems with your eyes, your vision's been fine. All right, just open and take a look. All right, looks good in there. All right, you can lower your mask for me. Do you have any pain here?
Like a little, yeah.
A little sensitive? All right, so I feel some lymph nodes. How about here?
Yeah, a little.
Anything on the back of your neck?
Mhm.
No?
Mhm.
All right, I'm gonna take a look in your nasal cavity and then we're gonna check out your throat
Mhm.
and see what that looks like. Then I'm gonna check your sinus cavities. Feeling those, all right. You just look up, just look it up. All right, and stick your tongue out for me. Say ah. Okay. So, any pain here?
A little.
How about here?
Yeah, a lot.
All right, 0 to 10, what would you rate that?
Like a 5 or 6.
Okay, all right. So I think today you're on day 3, you said?
Mm-hmm.
So most likely I don't see any cobblestoning or purulent things or anything in your throat. It does look red. Your ears, your tympanic membranes both look okay. The right one is a little red. It's not too concerning right now. I'd be more willing to say that this is viral.
Yeah.
So in 7 to 10 days, kind of wait it out. Hopefully you'll start feeling better. We can give you some like Tessalon pearls to help you sleep at night. You can also prop yourself up. I think that would help you sleep. And we can do some, keep going with the Motrin with the pain, get plenty of rest, drink plenty of fluids. We can try some Mucinex to thin out the secretions.
Yeah.
And then I want you to follow up with me, in definitely in 10 days, if you're not better, come back and we can probably treat you for acute sinusitis. Have you had sinus infections before?
Yeah.
Yeah, and how often?
Oh, maybe like every other month or something.
Oh, really? Okay, well that kind of, so what do you normally take when you get sinus infections?
I just normally just like write it out. Use a humidifier. Yeah.
Okay, so you do some stuff. I was gonna say that's another thing you can do as well. The neti pot is great. I would suggest continuing doing that. Have you ever been referred to an ENT?
No, I haven't.
Okay, I think that's something we could do today too, if you're having these all the time,
Yeah.
just so you can get established with them and get set up. So we'll go from there. Is there anything else that I can help you with today?
No, you don't think it's COVID, right?
I don't, but that's a good thing. I think we can, we'll do a swab.
Okay.
We can do the flu on piggybacked onto that, just to rule that out. I don't have high suspicion for that. You are vaccinated according to your chart. And you've been afebrile, you haven't had a fever, right?
Yeah. As a kid too, I also sometimes got strep.
Okay,
Yeah.
all right, so we'll do a strep and the flu swab. We'll test you for COVID.
Okay.
Pending that none of them come back positive, we'll stay with our plan. Now, if strep were to come back positive, we'll go ahead and treat with an antibiotic for sure. COVID, more just to be aware, you'll do your quarantine, isolate, stay away from people, and the flu, essentially the same thing. We don't want to pass the flu around either.
Yeah. Makes sense.
So is there anything else that you can think of while you're here?
No, nothing I can think of.
Okay, are you feeling super congestion with the pressure? Does the Motrin help?
Yeah, it does.
Okay, do you have enough of that at home? Okay, make sure you eat with that because it can upset your stomach, okay? All right, well, thank you so much. And I will get all that put together for you.
Okay.
And we'll get you on your way.
Okay.
All right, thank you.